Hello.
Hey,
Good
just
morning.
trying to move my camera.
That's okay. Take your time.
Can you see the top of my head?
No.
I mean, this is really important, my crown.
Hi, Case.
Yeah, I don't know how this is going to work. Let me move that back.
I'm going to change this lighting. Gosh. That's fine.
Yeah?
Yeah. You good?
Yeah.
So good morning everybody that's joined us for the first, I'm very excited, the first episode in Mother Nature's Recipes Holistic Health Series, a bit of a mouthful.
Mm-hmm.
So I am joined by the lovely Louise of Align Therapy Clinic. I'm just going to start with a quick introduction of what we do and why we're here, and then I'll pass you guys on to Louise for her to introduce herself. So just a brief introduction about me. I'm Kayla. It's lovely to meet you all. I started Mother Nature's Recipes back in 2015 after experiencing a really difficult time breastfeeding my first child, my son. And I wanted to try and find a way to support women in a multidimensional way through periods of isolation by giving them a support network. And so it transitioned into creating products. So I've been creating teas for over a year now to support the different phases of early motherhood. But I'm also very passionate about creating safe spaces for real representations of motherhood, you know, just to be honest about our experiences and to also create visibility for resources that can help women and mothers through those different periods throughout motherhood. So we're doing these lives because every month throughout 2022, I will be doing a live with a different brand who provides a product or a service that works holistically to provide support through the perinatal phase. And then on the website, I also have a directory, which this is going to link to. So all of those brands will be accessible on the directory, because I'm really focusing on, same as Louise actually, visibility throughout 2022. And it's really important to me to be able to provide visibility to brands and businesses that can truly kind of change the whole experience of pregnancy or postpartum, because I feel like there's so much out there that mothers do not know is available to them. For example, when I was having my issues with my son, it's because his mouth was too small to latch on. And I had no idea that I could have visited a chiropractor that specializes in care for babies and mothers, and I could have had his jewelry aligned. So it's things like that, and it like blew my mind when I found out about that, because I was like, what? You can have treatments done on babies?
Yeah.
So it's just about making these services more visible to truly help those that really need it. So enough of me. I'm just going to pass you over to Louise and we'll get the show started. And she's just going to tell you a little bit about herself and her wonderful business. So Louise.
So, my name is Louise Thompson. I'm a mother to the most amazing 2-year-old, owner of a Align Therapy Clinic, and a part-time baby swim teacher.
Oh yes, I forgot to mention that's how myself and Louise know each other. We work for the
Yeah,
same company. We're both swim instructors for
yeah.
the same company. So yeah, that's how I know the lovely Louise. Sorry for interrupting. Keep going.
That's all right. So, what do I do? So, Align Therapy Clinic is a private physiotherapy practice specialising in pelvic health conditions, and my interest is antenatal and postnatal women, really. Yeah.
Okay. So could you just start by telling us what physiotherapy is. I'm sure a lot of people know, but just for everybody here, because I feel like sometimes it can get confused with other practices. So could you just give us a basic idea of what it entails?
So physiotherapy is a way in which you can restore and maintain mobility. It's mainly done through movement and exercise. We emphasize a lot in education and advice just to maximize a person's function and well-being, and also used to minimize risk or injury in the future. As physiotherapists, we're taught to treat the whole body, so not just the main issue. We're looking at the way it affects them emotionally, also physically, psychologically and socially, and just making sure that the patient's in the center of our treatment, just to improve their quality of life.
See, that's really interesting, because I had no idea about that. Because after I had PGP with my second daughter, and I went to see a physiotherapist, but I only went for one session and I never went back, stupidly. But I had no idea that it entails everything. I literally thought it was just the physical aspects of the body and pain and trying to ease that. I didn't realize it kind of takes on the emotional side of the psychological side as well.
Yeah, in our assessments, just any bog standard physiotherapy assessment, we ask a lot of questions, and that really helps us underpin. So we might ask you things like, how are you managing with your activities at home? Are you managing to get up and down the stairs? Are you managing to look after your children? And we're thinking about, okay, the social part. Do they need support in getting in and out of their bed, or do they need support in and up and down the stairs? How it's affecting their work, how it's affecting their mental state, how it's affecting their sleep. So we don't just ask, okay, what's the problem, what's going on there? We ask and think and take everything else into account to treat that problem and everything else around them.
Okay, incredible. Okay, so can I ask why you chose to specialize in pelvic health and women's health? And also, can I ask if motherhood impacted that decision at all? Because I'm assuming you were a physiotherapist before you had boy. So did him, first I'll let you answer the first question, but in the second part of the question, did you having your son affect your decisions at all?
So I've been a physiotherapist now for about 11-12 years.
Oh wow.
So a very long time. And I first became interested in pelvic health about, I want to say 7-8 years, when my sister was pregnant with my nephew, and she just kept on asking me, "Oh, Louise, what do I do with this? What do I do with that?" And usually I'm like, "Yep, you do this, this, and this." This time I was like, I don't know, because in university we don't get taught anything about pelvic health or women's health. It's if you are fortunate enough to get a rotation where you see that population, but we don't get taught about. We didn't get any training in university.
Really?
No. Now it's becoming more it's becoming accessible for the students, because it's, pelvic health is like a big buzzword at the moment. But we didn't get any of that training, and I was just interested in what we do with pregnant women. So I did a load of courses back then, but didn't take it that seriously. I just thought, if I can educate myself, at least when I'm seeing these patients coming through the door, instead of just sending them to a specific physio, I'll be able to treat them and then, refer them on to whoever they need to see afterwards. Anyways, after that, I found, I looked for a hospital where I could get more experience in women's health. And it was very limited. There was very few hospitals that you could work in, and that was offering a rotation in women's health. I managed to get on that, and I think once I was there, I was like, yeah, this is me. This is where I want to specialize at. And it's just I think helping a woman, especially through pregnancy, it's a very short period of time in their life, but you can see the benefits very quickly. You can see how it, a lady's day will just be made so much easier for that time and that you put into their assessment and treatment. So yeah, I was just like, this is where I want to work. I did more courses, educated myself, asked more questions.
Mhm.
And then when I had my son, I was just like, yeah, we need this service. We
Mhm.
definitely need this service.
Mhm.
And I think when I was, before I had my son, actually, let's go back to that. I worked in a London hospital,
Okay.
and in the referral system was a little bit hit and miss. There'll be patients that will go to their midwives at like 18 weeks and say, oh, I'm having pain. They're like, oh, it's fine. You're just having some pelvic girdle pain. It should pass. Okay. They go back to their midwife at like 26 weeks. This pain is really getting quite intense.
Yeah.
They then refer you to physio. That probably doesn't get picked up in physio till about 28 weeks.
Right.
And then once they get offered an appointment, it's about 30 weeks. And then by the time they get into physio, they probably only have about 3 or 4 weeks worth of physio. And in that time, they'll probably only get seen once or twice.
Mhm.
And they'll come all the way to central London. And I don't know if there's any pregnant women listening, but when you're pregnant and you have to travel on public transport,
Yeah.
it's a whole day deal, especially if you're like 36, 37 weeks.
Mhm.
You don't
Mhm.
want to leave your house. You don't want to
Exactly.
get on public transport.
Yes.
And, you know, it's like you might only have a half an hour appointment. It's going to take you about 3 hours just to get there, because you need to make sure you factor in your rest, you factor in your snacks,
Mhm.
you know, finding the place. And I was just like, there's a need for this. That needs to be accessible. That needs to be somewhere comfortable. Like if I can't travel into my appointment, I want someone to be able to come home and come and see me in
That's
the
right.
comfort of my own home.
That's right.
So I think that all of those things, especially when I was pregnant myself, I was just like, yeah, I need something that's on my doorstep. I don't want to have to be traveling all the way up to central London.
Mhm.
And I think that's where Align Therapy was born,
Okay.
really. I remember actually vaguely writing a business plan like a month after my son was born, because I was like, yeah, we're getting on top of this. I didn't look at it until about a year later, and I was just like, it was very comprehensive.
Mhm.
I really wrote this. But you know, when you're sitting there breastfeeding, you spend so much time breastfeeding, and you're just like, what should I do? Get out my notebook and started writing.
Mhm.
So he definitely swayed my decision. And I think that whole thing of working full time with children under 2, difficult.
Yes.
It's you know, I take my hat off to, I was talking to my sister the other day, I take my hat off to my mum and grandma that would work, have the kids, several jobs, and they just made it look easy. I don't know how they're doing that, but I was like, I can't. I physically can't.
Yeah.
I'm not cut out for that
Me
life.
too.
Yeah. So I was like, I need to make it easier for me.
Mhm.
I need to make it more flexible for me as well.
Mhm.
So after having my son, I was just like, yeah, we need to make a shift. I want to be able to see my son. I want to be able to grow with him. I don't want to have to drop him off at the childminder, him being at school all day, and I see him for an hour before he goes to bed.
Mhm.
It doesn't make sense for me. So yeah, I had to make sure I made those changes to fit in with my life at the moment, and ensuring that I can grow with my son.
Okay.
So yes, he definitely impacted the shift in my work patterns.
Amazing. And did your expertise come in handy throughout your pregnancy? Like, were there any ailments that you had and you were able to treat yourself, or just have more of an understanding of because of your knowledge?
Yeah, I feel like I was able to treat myself. To be fair, I have a mental block when it comes to treating myself. I don't know why, but when it's like I've got to do something for myself, it's like I've got to switch on my patient head and my therapist head, and it's a little bit difficult to do the two. But I was able to treat myself, and I knew what I needed to do, and I was able to source, find people that needed to provide me with support. And one thing pregnancy did help me get is a better understanding and empathy for my patients. Because before pregnancy, I'd be like, you need to do this, this, and this. And then when they come back saying, you know what, Louise, I wasn't able, and I was just like, why? Now I understand why.
But that's so important, though, isn't it? Being able to connect with them, because I feel like that just kind of transformed the entire way that you're able to treat them, because you have that personal experience. So you know, it's just more personal and kind of individualized for each patient, because you have an appreciation of what they've been through.
Definitely.
Yeah.
That I feel like since having my son and then treating my patients, I'm not going to set you a million exercises, because the reality is you probably have 5 minutes when you're in the
Yeah.
bathroom scrolling on Instagram to do any exercises.
Yes.
You don't have that time. So it's just trying to incorporate it in their day. And I feel it's made me a better practitioner, because I can have that lived experience. I have the understanding. So yeah.
Amazing. No, that's fine. You drink your water. I know you love your water. So when I was looking through your website and formulating my questions, I saw that you spoke about your company logo, and I found it really interesting, like the detail, because I know you're not the sort of person that messes around in the first place, but the detail of your logo, to how it connects into what you do and the purpose behind what you do. Could you just tell us a little bit more about that?
Yeah, so my company logo and my company name took me a long time to finalize. And you know that I pay attention to detail.
Yes.
So it wasn't just like, this is what it's going to be. And that, no, I had probably about 4 or 5 pages of just names. And I wanted it to be positive. I wanted it to be warming. I wanted it also to have that professional look. And I wanted something that would encompass what I am. Yeah. So align, which means to give support, to put in a straight line, was so important for me, because names are important. A lot of cultural, in different cultures, your name tells you your lineage, your history, your tradition, and I wanted that with align. So yeah, align is not just the letters; it has a deeper meaning. So that is why I chose the name Align. And then my logo. So this was by chance. I wanted 3 shapes, and one of them was about my profession as a physiotherapist. Another one was about the passion of helping people, and then the other one was about my fire to educate people on pelvic health physiotherapists and pelvic health conditions. So it actually started off being circles. I was drawing circles and they were overlapping. I was like, no, I don't like this. Went to squares, I went through a whole load of shapes, and then I ended up with triangles.
Okay.
Originally they were upside down. Okay. So sometimes when you've been at something for a long time, you just leave it, come back, go away, come back. I came back and I looked at it and I was like, oh my gosh, it looks like a pelvis. I was like, this is the logo. This is it. I can't remember where I was, but I took a picture, sent it to my partner. I was like, look. He's like, yeah. I was like, but look. He's like, yeah, I don't understand. I was like, it's a pelvis. I was like, yeah, this is it. So I worked with a graphic designer to get the final product, but the pelvis, the triangles come together to make a pelvis. I'm doing pelvic health. And then the 3 stones that are stacked on top of each other, just talking about that coming to the center, making it all in unison. And then it's finished with what's that thing called? A circle all the way around. And that was my meaning of the circle of life. Anywhere that you start in this circle, you're always going to come back to the beginning. And I feel like that's how life is, really. You go back, they say once a man, twice a child. You're always going back to that starting point. Of course. And then my slogan on my logo is support where you need it most. Important, because during my pregnancy and in a postnatal period, we need that support. People don't understand it. We need that support. And I always say my partner supported me throughout my pregnancy and in that postnatal period, and I am so thankful for that. But I feel like that is important. And it just means that if I can give you a little bit of advice or education to give you that little bit of support, then I've definitely accomplished something. So that's why I've put my logo on the website, because I feel like it gives you a bit of insight and gives you a bit more knowledge and depth of why I've chosen these shapes, why I've done this, why I've chosen the color gray. When I put gray into the computer, it came back with a lot of positive words like calming and credibility, viability. I want that from my logo. And I actually went back and forth with my sister. She was like, Louise, you can't, it's got too much on there. And I was just like, it's important to me. I feel like people need to understand why I've done this.
No, I agree. I think it's
So yeah,
very important. Like
yeah,
that's why I wanted to bring it up during this live, because when I read it, I was like, the detail in it. I'm very much, I don't know about everybody else, but I'm very much like an emotional buyer, and especially in a service that it's in relation to my body. I want to know that the person who's treating me or looking after me, one, has my best interests at heart, but it's just truly passionate about what they do to be able to provide me with the best care. Because especially in moments like pregnancy and postpartum, where, you know, it's a highly emotional time.
Yeah.
Like, you're up and you're down, your hormones, physically, your
All
body's
over the
not the
place.
same. You're all over the place, and you're looking after this tiny human being. So if I'm reaching out to somebody for help, it's a big deal. And I need to know that that person has my best interests at heart. And that's what I loved about your logo. So that's why I wanted to discuss it. So thank you.
Thank you. Thank you.
So next question. So why do you think that conversations about topics such as pelvic health still are not kind of being normalized and being opened up as much in 2022? It's still kind of, for me, from my perspective, I feel like it's still kind of a little bit taboo. Like, we don't know enough about it.
You know, I don't know. I feel like it's a taboo subject because we're meant to keep our privates private.
Yes.
Yeah, and we're taught at a young age, these are your privates. Do not discuss them with anybody. And it's crazy because we talk about all the other illness, talk about how you've got a migraine, how you've got a toothache, how you've got, you know, a backache, but you're not going to talk about how you've got pelvic pain.
Yeah.
And I feel like even now I have people say to me, oh, don't talk about pelvic health. I want to know when I'm pregnant. I don't want to know now. And I'm like, it might be a bit too late then, or tell me when I'm over 30. Everybody has pelvic floor muscles. Every single person in the world has a pelvic floor muscle. And if you was to have greater understanding of why you need to do your pelvic floor exercises, then you will do them. I don't know, I can't remember who it is, but I make jokes that if you don't do your pelvic floor exercises, then your bowel's going to drop out your bottom. And then, okay, I'm going to do my pelvic floor exercise. Get tactic. But it's true.
It's
because
true.
Your pelvic floor supports your pelvic organs. And I feel like we need to make a conscious effort in breaking down those barriers and involving those conversations at a very young age. When we're in school, when we have PSHE, we get taught about menstrual cycles, and we get taught about wearing pads and looking after yourself and your hygiene. They just need to slip in your pelvic floor then. Yeah, a little bit younger might not work because they don't really understand. But you see, when you're in secondary school, that's something that you need to be focusing on. And yeah, I think we should be able to freely talk about our body parts at any age. And like, I think it starts from young. Like, you're not telling your child it's your winky, you're calling it the right name, the mini, you're calling it the right name.
I'm with you. I'm so with you that these conversations need to be added up, and I feel like you're right. It needs to, these conversations need to be had on so many levels. It needs to be had in education, it needs to be had at home. But you're right, that we are taught, especially as women, not to talk about these things, and these things are private, or in other aspects that they're dirty, and you're just supposed to keep it to yourself. It's something that happens to so many of us, to all of us, but we're not supposed to divulge it to anybody. And it's like, why? Like, even now with my 3-year-old daughter, I'm opening up these conversations with her, and she's just, it's nothing to her. Like, she's so receptive to it, and I'm just trying to change that stigma. So I think it's really important what you're saying. I feel like at school, these conversations should be added into the PHSE lessons and whatnot, because it's fundamental. This is something, this is your pelvis, this is something you have, it's something you're going to grow with, and you need to make sure you're looking after it. So I completely agree. We have a question for you, Louise, from Nina Knitted This. She said, with your professional and mother hats on, when would you say is the best time to actively get support?
It depends. So, what was the question? If the best time to actively get support. So, if you are looking at becoming pregnant, then you can go in there. When you've just had your like your 12-week scan, we normally say around 12 weeks, just come in, get an MOT really, just like you would with the car, just to see how you're ticking over, just to get information about your pelvic floor exercises, try and see if we can modify any movements just to make you a little bit more comfortable during that period. And then after you've given birth, so I've seen patients from about 8-9 weeks all the way up to about a year after they'd given birth, and I treated them throughout that whole time period. And I feel like the more information, education, advice you're given earlier on, it will make it a little bit more easier for you to manage. And then you can also work out, okay, I'll see at the beginning of my pregnancy, things are not going well. I know I've got that access to a physiotherapist to say, okay, let me go in and have her check me over. So the best time, I would say, it all depends on the person and where they are in their timeline. But essentially, actually getting support is the first thing.
Okay.
So anytime, really, you need to come in.
Okay.
That makes sense.
That makes
answer your question.
sense. Nina's asked another question. So she said, is it ever too late to start thinking about your pelvic health?
I mean, no. I would say no. Why I would say no is because the fact that you're having these thoughts is a good thing. We want you to be thinking about your pelvic health. No time would be too late, other than, for example, if you were having like major prolapse or something, which is a little bit later on in life. But I think, even if you've had your baby a year ago, 2 years ago, it will not hurt for you to come in and be assessed. If you are 3-4 months into your pregnancy, it's not going to hurt for you to come in and check your pelvic health.
Okay. And Louise,
is
physiotherapy a response treatment, in the sense that, is it a treatment you have when you're presented with an issue, or is it something you can just have throughout your life, just to make sure you're in peak physical conditions? Do you get?
Yeah, so you can have like different types of treatments that you receive. Physiotherapeutic treatments can just be maintenance. So you could just come in to have a maintenance, for example, massage, or you can come in to just have acupuncture to make sure that your chi is running, your energy is running through your body nicely. You don't have to come to physio if you have a problem. And I feel like people think, oh yeah, I've done something, I need to go to physio. No, you can just come to physio for to see what's going on. And you'll be surprised, because we are trained to look at the body. You will see things that you didn't even know existed, or you didn't even know what was, and it might not even be giving you a problem, but it's just to make you aware of what is going on with your body. So no, you don't have to have a problem. You don't have to be in pain. You don't have to have any of that in order to seek physiotherapy.
Good. I think that's really good to know, because like you, I've noticed that people do often wait to have a situation before they seek help, whereas I feel like it needs to start the same way we said the conversations need to be opened up. We need to start thinking about treatment as an ongoing thing, as a lifestyle choice, rather than just a response to pain, And
it's just like, I see physiotherapy as like your MOT. With your car, you don't wait until your car breaks down before you go and get it checked over and serviced. So why do we leave our bodies to be run down into the ground, and then we're like, oh, maybe I should go and see somebody?
I know.
Could have prevented that, but yeah.
I completely agree with you 100%. Would you be able to give us an idea of some of the conditions and ailments that you get to see in your work?
So one that we get a lot of is pelvic girdle pain. So that's pain in and around your pelvis. We get low back pain,
Mm-hmm.
pubic symphysis.
What's pubic symphysis?
So, got my little model here.
Okay. Well prepared. I
So
like it.
it's basically pain in your pubic region in here.
Okay.
So where your body is adjusting to a growing baby,
Mm-hmm.
you will get a bit of discomfort in this region.
Okay.
So it's just in here, and sometimes, for example, you get your adductors, which are the one of your muscles in your legs that bring your leg into this position. That
Okay.
might be tight, that might be pulling on it.
Okay.
So you get a lot of adductor pain. I'd say postnatally, I get a lot of upper back pain because
Okay.
people are sitting like this,
Mm-hmm.
trying to breastfeed for a long time, or they're holding their babies on one side.
Yeah.
So it's just trying to get that body back into alignment. At the moment, I'm treating a shoulder,
Okay.
lower back, knee, plantar fasciitis. There's a whole range of things,
Okay.
but I'd say antenatal and postnatally, it's more pelvic girdle pain, lower back pain,
Okay.
upper back. Yeah.
Okay. And can you give us an idea of some of the treatments that you'd use to help ease these issues?
Yeah. So we do. I do quite a lot of manual therapy, so soft and deep tissue massage, myofascial release. So that's just trigger point release, so applying pressure over like a painful spot. You know when you feel like you've got knots,
Yeah.
applying pressure to remove that.
Okay.
Kinesiology taping, so that is, I don't know if you've ever seen sports people that have like these colourful tapes on them.
I'm really interested in this. Yeah. So
Yeah.
I'm listening. Yeah, because I saw it on your page and I was like, I've heard of this, but I don't know what it actually is. So yeah, please go on. Go on.
So it's a bit of sticky tape, and it helps to provide support but also allow you to move.
Okay.
So there's different types of tape. So they've got like a really stiff, rigid tape, and that is not helpful for us because our body moves. So the kinesiology tape that I use is flexible, but it still gives you a little bit of support. And like especially during pregnancy, my pregnant women, I don't know if you've ever had your belly and you just want to lift it up.
Yes.
I can do that with the tape.
Okay.
Lift it up, and it just feels like, oh, it's a little bit lighter. I can move a little bit more.
Yes.
So it helps to relieve pain by deloading the tissues and allowing for movement underneath. So another way that I might use it, for example, if a person has pain in their bottom, I can tape over the area, and that just gently lifts up the tissues, the superficial layer of the tissues, to allow for more movement underneath. So kinesiology taping, I use it in conjunction with something else. I don't just use the kinesiology on its own. But yeah, sometimes I can use it as a reminder. So one of my postnatal ladies was constantly sitting like this, and then she was getting pain, tightness in her pecs, she was getting pain in her neck. So I taped her back just to give her that reminder. Every time she felt herself going like this, and she needs to get back into a better posture. So yeah, there's different ways that you can use it. But it's something that I don't just use on its own. I don't just give you tape. I will tape it with exercise or education. That's another thing. Education, that's a big part of my treatment, because I feel like once you're more informed, you're more likely to do whatever I'm asking you to do. And when I say education, it can just be as simple as your posture, or seating whenever you're going toilet, or you know, what your pelvic floor does. So I do give a lot of education and advice in my treatments. Acupuncture and dry needling, so that's just to try and help the chi run around the body, and balancing energies and things like that. Mainly used for pain relief. Scar tissue management. So with my C-section ladies, just teaching them how to mobilize the fascia. Because a lot of the time when the way that the body lays down collagen to repair a scar, it can just get really stuck, and we just want it to it can like change your movement and things like that. So just getting in there early, just to try and break down those adhesions, normalize sensitivity and touch in that area, which is very important.
So what do you do to the area around the C-section?
So it depends on what is going on, but a lot of the time when women have their C-section scars, they don't want to touch it, and they don't touch it for about 6-7 months. But we try and get in nice and early, and sometimes we don't even go onto the scar. It's moving the fascia above and below the scar, just to allow for normal movement. Because obviously with those C-section scars, they go down through a lot of layers, and they go down quite deep. And where it is, there's a lot of like muscles, ligaments, soft tissue, all of those things in that region. We just want to make sure that they are moving correctly. We don't want it to be stuck down in a specific place. So yeah, it's just treating them to understand what's going on with their scar, how to normalize touch and sensation in that region. Posture management. So just looking at their posture, giving them tips and advice on how to better their posture, especially those postnatal women who've been sitting like this, breastfeeding their children forever. Because obviously this is just going to cause tightness in these muscles, overstretching the muscles in the back. What else do I do? Pilates. So Pilates-based exercises. So why I like Pilates, because it's a gentle form of exercise. It also concentrates on your breathing and your pelvic floor, and even though it's slow and controlled, it's very challenging.
Yes, it is.
If I'm taking time off my Pilates and I go back to it, I'm like, oh, this is a bit cool. But I like it because it's gentle, and my pregnant ladies and postnatal ladies can manage it. And it is a form of exercise. Hydrotherapy, so that's exercise in water. Because, you know, when you're in the water, a lot of gravity is eliminated. So women find it a lot easier to move around in the water than on land.
What don't you do?
Sleep, rest. Yeah, I think that's mainly what I do.
Wow, I had no idea. You see, this is why these conversations are so important. Like when I was listening to you about the treatment for the C-section scar, I was like, there's treatments for C-section scars. It's just, it's so key for us to be having conversations like this.
Exactly.
I'm so happy to be doing this right now. Nina has one more question. Yes, she can do it all, Mike. She is Superwoman. I agree. Nina says, "What does an initial session look like with you versus the NHS?"
So I'll give you what you have in the NHS. So NHS, limited time, limited space, limited money, limited people. So you'll come into an NHS appointment, and personally, I feel like it's rushed. You don't get that connection with your therapist. You sit down, they ask you a load of questions, and then you're out the door. You don't see them for 3-4 weeks. With me, I take my time, okay, because I think it's important, especially to make sure that the patient is safe and comfortable. We can't rush these things. These are important things. And if it just means our first assessment, we just talk about what is going on, then we take it from there. But I feel like I give more time. I allow you to let me know. So we do a lot of talking in the beginning in an initial assessment. I ask about you. I ask about you know, your past medical history, what your activity level is, other children, family, because again, we're trying to incorporate all of this in a part of our treatment plan. I give you time, and I think that is one thing that I really appreciate. I can come to you. If you can't come to me, I will come to you. So if you are in a little bit of pain today and you can't travel to my clinic, I can come to your house. I've got my treatment bed. I can come in and treat you there. And I think the time is the one thing, that relationship that you build with your therapist. It's very hard, especially in the NHS. You might see me today, you might see another person next time, you might see, and I don't know if you found this with your midwife appointments.
Yes.
You see different, you can't build that rapport with them, and it's like every time you get there you have to go through your history all over again, and that takes up a good 10-15 minutes, and then they'll say, oh, have you done this and this? Okay, bye, out the door. Whereas with me, it's that continuity of care. You're going to be seeing me all the time. You're going to get that. And another thing, I don't know if you can see it, but seeing somebody that looks like me makes me feel comfortable. Yeah, there's very few black pelvic health physiotherapists, and I just think when I'm talking to another person that looks like me, automatically I'm at ease. Yes. I can use my slang, I can use different words, and they will understand. They have that understanding. Yes. You don't always get that in the NHS at all. You don't. No, you don't. So yeah, I think the difference is the time, the quality. Although I have my work phone, so my patients can contact me, and majority of the time they do it in sensible hours. But you know, if you wanted to speak to your therapist in the NHS, the chances that you'll get directly to them, pretty slim. Yeah. You can't call them and say, oh, Louise, this is what's happening. You'll probably go through a booking team, and then the booking team will book you into somebody's diary, which might be 3-4 weeks time. Whereas you can call me today and be like, Louise, I'm in a lot of pain. And I'll be like, okay, this afternoon I have this availability, or I can come and see you tomorrow morning. So that access as well is something that's different. And it's not so clinical, because sometimes, especially when you're discussing personal things, you don't want it to be so clinical. You don't want to feel like you're in a doctor's office and you're just I don't like that. And I try, like, my uniform is still professional, but it's not as, you know, I don't wear my tunic, because when I'm working in the NHS I use my tunic, but when I'm working at home I have my polo shirt on and my my jumper. But yes, I feel like all of these things just make you feel a little bit more at ease, and when you're comfortable, you're more likely to open up and able to get to the root of what's going on. So that's the difference, Nina.
100%. When you said time, that really resonated with me, because sometimes I'm sure you'll get women coming to you presenting with different issues. But maybe they're just having a rough time, and they just want somebody to hear them. They just want to speak to somebody that gets them, that will hear them out, you know, and just being able to give them that time and that continuity of care, I'm sure plays a major role in their ongoing treatment. Because like I said, when it's your body, and especially when you feel so, you can be quite emotional about your body after giving birth or even before giving birth, I think it kind of intensifies those emotions as well. So you just want somebody that
to listen.
That just gets it, and that will give you that space and create that kind of safe environment for you to be true to yourself in, to really say what's going on. And that's why I really love what you said about kind of bringing everything together. It's not just the physical, it's the psychological, it's the emotional side of it, because it all comes together to make up your health and your well-being. So it's so fundamental. So I love that. I will save the lives, Shay Hill. Don't worry. I promise it will be accessible after we finish. I've just got a couple more questions. What continues to drive you to do what you do today?
So I would say there's two things that sort of drive me. One of them is seeing people lack understanding of pelvic health conditions and what pelvic health physiotherapist does. So I feel like I need to get that out there. I need them to know. I want you to know. And it's like, I want to save the world. I can't, but I want to save the world. I want everybody to have good pelvic health. So the fact that, you know, we're still I still have, like, I spoke to somebody yesterday, and I was talking about pelvic floor exercises, and they were just like, oh, it's just my front passage. I was like, no, it's both. You need to do your back passage and your front passage. I'm like, oh, I never knew that. And I'm like, well, you know, third baby in should really be taught these things. It's important because, you know, it supports your pelvic organs, and that's your bladder and your bowel. So that was like, okay, I need to be doing more information, getting people understanding what your pelvic floor exercises are, what your pelvic floor is, where your pelvic floor is. So I feel like still seeing people that don't know what I do, why I do it, makes me say, okay, I need to keep getting that word out. And then just my son, like, as much as I need to provide for my son. I need to provide for my son. And I just need to make sure that he understands why, because pelvic health is not just for women. Like, we have a lot of women in the industry, and they are getting older. They are going to go through the menopause. Men need to understand what that looks like and how to manage that. So I feel like it's and that's the reason why I don't like to use women's health, just because it doesn't only just mean women. It's also men have pelvic floors, men have pelvic health, and everybody needs to understand what is going on. So yeah, having people that are still out there not aware of pelvic health conditions makes me say, okay, I need to drive, I need to keep going. And my grandma, who had pelvic health condition, it was not until I received a gynecology oncology letter that we realized this is actually happening. And I think it's that whole thing of being open about what's going on, having these conversations from early. And I don't want, like, any of my family to be in that situation that, you know, when they're in late stage cancer, that's when they want to start thinking about their pelvic health. So yeah, I think I think there's a lot of things that make me get up and, okay, this needs to be done, and keeps me going every day. But I think mainly the fact that people still don't know about pelvic health or pelvic health physiotherapists. And just looking at my son and saying, yeah, we need to do this. We're getting up and doing it for you.
That's wonderful.
That even answered the question.
It answers the question on so many levels, and it's such a brilliant answer, because I just agree with you tenfold about needing to open this up more. And I can completely understand what you said about being inspired when you're speaking to people and they still don't know what pelvic health is, you know, even to a certain extent what physiotherapy is. Like, these conversations need to be opened up and normalized, and I hope in having this live with you today we've just helped to widen the conversation a little bit more. So guys, we're going to end the live very soon, but I just want to say a massive thank you to Louise. I'm sure you can all agree that she's been wonderful, and we've learned so much here today. I'm still reading off of that C-section information you gave me. But her details will be on the directory, which is mothernaturesrecipes.com/directory. The link is in my bio. You can access her website through the directory, and also I'll be posting a blog from Louise tomorrow on the site as well, just to give you some more information if you didn't catch the whole of this live. But I also will be saving it to my profile. So I just want to say thank you so much, Louise. I'm truly grateful for you and everything that you do, and I wish you the best going forward. And I'm sure we'll be back on here in the future talking some more.
Thank you. And I want to say thank you, Kayla, for inviting me and bringing me on board with this journey. Just a little last thing to say.
Yeah. When
Kayla emailed me saying this is what she wants to do and she wants to talk about visibility, I was just like, this was my 2022 is I want to be visible. And I was like, and I think I got it like a couple of days after the new year, and I was just like, this is aligning
Yeah.
with, with everything that I'm doing at the moment. So
Yeah.
yes, thank you very much for having
Oh, it's
me.
my pleasure.
Um,
It's my
Thank you all
absolute
for
pleasure.
tuning in, and yeah, catch us on IG.
Yeah, definitely. But keep tuning in, guys, because like I said, each month will be a different live. Next month, I'm talking to Hannah Pern and Claire King Therapies as they set up Streatham Community Clinic to serve their local community with holistic therapies. So keep tuning in, and thank you all for watching today, and thanks again to Louise.
Thank you, Gayla. Take care.
Take care, guys. Bye.
Bye.
Bye.